Good afternoon, everyone. My name is Jennifer Hinojosa. I'm a Research Associate and Data Center Coordinator at the Center for Puerto Rican Studies. I will quickly review a web map application in response to the COVID-19 pandemic in Puerto Rico. So, in the interest of time, I'll walk you through our web map application. So let me log out of this. So to access our web map, for now, it's located in our Centro homepage, and it's located in centropr.hunter.cuny.edu. I'll repeat it again, centropr.hunter.cuny.edu. And once you log in, once you get to that homepage, you might want to scroll down, and you'll see here COVID-19 positive cases. Click it. Give it a few seconds. Okay, so here you will see pre-selected layers that have been selected, and what we're currently viewing are the COVID-19 positive cases at the health region level as of April the 3rd, and you're also seeing the location of hospitals. And if you click on any of these health region boundaries, so let's click the metro, what you'll see here is the data between April the 3rd and March 27th. And if you click on the source, it will directly take you to the Instituto de Estadísticas dashboard, and this is where we source our data. And you could always click out of this, and if you click on the housing layer, it will give you the information that relates to that particular hospital. And I will review a bit more into this because we also have another layer related to hospitals from Esri, and we've just uploaded that layer a few minutes ago. Now, say for example you want to change this, you want to go to content, and here you will see all the layers that we currently have at the moment. We are adding more layers as we speak. And then, so every time we're updating a layer or even adding more layers, we'll definitely let you know. So, but in the meantime, this is what we have. So we have hospital layers at the moment. We have HUD's CARE Act grants at the municipio level. This is the data that was released yesterday. We also have the COVID-19 cases at the municipio and the health region boundary. We also included some socio-demographic related layers from the ACS, both at the census tract and county level data. And lastly, we've included the CDC social vulnerability index, both at the municipio and census tract boundary. So let's unclick this. Say, for example, you want to look at the COVID-19 positive cases at the county level. So here we have it, and this is data as of April the 3rd. And what you see here, and again, similar to what we looked at the health boundary level, if you click on any of the counties, you're able to see the data for that particular municipio. So for example, as of April the 3rd, it was reported about 5 cases with COVID-19. And so again, you can unclick this. So if you want to change the image of this, you could always do that. But before we get to that, let me just review some important icons. So here is the layer. So this is the way that the data is illustrated. And if you look at this table-like icon, just click on it. And then here you will see all the data, right, for April the 3rd and April the 1st. And again, we are updating on a daily basis. And say, for example, so let's click out of this. You want to change the color of this map. You can always do that if you click on this icon that says change style. Click it, and here, you could always go to April the 1st, but for the sake of timing, let's just look at April the 3rd. And you could change the way, the symbology of your map, right? So you could change it like this, or you could just keep it as is, and then you could always change the color. So if you click symbols, and it gives you the options of the different colors, and then you can click here on the outline. But again, just for the sake of time, we will keep moving along. But once you sort of test this out, it gets easier. So click OK, always click done, and there you have it. So say for example we want to see, so we're looking at positive cases at the county level. Now let's see who lives in this county, right? So let's take Ponce. So you could always zoom in here. And let's look at, perhaps you want to look into the 65 years and over age group. So if you unclick this and you click here, we see that in Ponce, it looks like, it has a pretty large group relative to other areas. But again, this is total numbers, right? And if you click that, it'll give you the number of individuals who are 65 years and over. And in this case, it's about 28,700. And those that are 75 years and over, it's about 12,600. Okay. Now, say you want to add or overlay the positive COVID-19 positive cases, right? So you could always click here, right? Now this doesn't show you much besides 2 layers, on top of each other. So we definitely need to change one of the layer symbology. So in this case, let's change the COVID-19 positive cases. So if you click on change style, select the symbology of this, right? So it gives you what each circle represents right here. So what this shows you here is the, again, everyone could come with their own conclusion here, but just for the sake of timing, this just shows you that in COVID-19, positive cases are seen in areas, well, particularly in the San Juan metropolitan area, which also shows a pretty large group of the 65 years and older age group as well. Now let's look at, for example, perhaps you don't want to look at age group. You want to look at the social vulnerability index, like how socially vulnerable that particular county is. And we could also look at a lower geography level, which is the census tract level. So if we click here, let's start with the county level. So again, and I think from the previous presentation, there was a discussion related to the dissemination of the COVID-19 data. But just again, for the sake of time, what this shows you that if we look at the CDC Social Vulnerability Index, right, click on the legend. So the darker the shade color it represents that it has a higher vulnerability, socially vulnerable, right? When you look at housing, age, household composition, they're socially vulnerable. And then the lighter the shade is that represents that have a lower social vulnerability, right? So what can we get from this data? So what we're seeing here is that the larger circles right here, which represents a large number of or high numbers of COVID-19 positive cases, are located in areas that have somewhat mid to low vulnerability. And then areas that we see here in the central region of the island and some of the coastal counties, we tend to see high social vulnerability index. Now, one thing you want to think about is that if and when positive cases tend to increase in these areas with high social vulnerability, that's a problem, right? So these are just some of the ways that you could look at our map. And then say, for example, you want to look into hospitals. So this is the other layer that we received from Esri. And if you click on it, again, it gives you same link as the hospitals data is the one that we looked at before. But what this data shows you is if you click on any of the hospitals, it gives you information on the type of hospital. So I believe if it was a children's hospital, in this case, this is a short-term acute care hospital. It gives you the address, and it also gives you the number of beds, the number of ICU beds, the number of staff beds, typical bed utilization rate. So all of that information is here. And again, you can always, if you want to look more in depth related to that information, you could click here on that show table. right? And all the information is here. And so say for example, we're done with this is what you want to show. Okay. You could always print your map with the legend, right? Or you could share your map and it gives you the link to embed it. Or you could share it directly to your Facebook or your Twitter page. You could always as well, I went through this, and then once you're done with this, like with the layers that you chose, click on legend and it will give you all the layers that you've selected. Okay. And then that's about it. I mean, at the moment, my team and I, we're still working on adding layers, updating some of the layers, but everything's accessible to you. And if you have any questions, you could always email me. This is my email, jhinojos@hunter.cuny.edu. And I believe I'll take your questions after we wrap up the webinar. But thank you very much and stay